Good evening, everyone. Good evening. How are we all doing? Let's give some minutes so that other students will join. All right. All right. Welcome. 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 So today we will discuss on something very important for your exams. Very important. Now I want you all to notify me. Can you hear me? Can you hear me? All right, let's continue. Welcome back to Brainy Academy. So today we are going to discuss on something very important, which is what? The skull bone. The skull bone. The skull bone. Now, the skull is a bony framework of the head that protects the brain and supports the face. I want you to write down. The skull is the bony framework of the head that protects the skull, the brain, and supports the face. Please, in the comment section, can you hear me? I believe you all can hear me. Welcome. So the skull is the bony framework of the head that protects the brain and supports the face. Just as your skeleton protects and supports the body, what protects and supports the brain is the skull. What protects and supports the brain is the what? The skull. Now, this will be a Viva class that will help you in your exams. But I will explain first so that it will be simplified. So, this is the skull bone. Now, looking at the skull bone, we have the frontal bones. We have the sphenoid. We have the ethmoid. We have the parietas. We have the tempora. And we have the occipita. I will simplify it. Just follow me. We have the sphenoid. We have the frontal. We have the sphenoid. We have the parieta. We have the tempora. We have the occipita. And we have the ethmoid. Then we have 14 facial bone. Follow me, I will explain. Now, the classification of the skull. The skull has 22 bones. The skull has 22 bones, and it can be classified into two parts. Number one, the cranial bones. The cranial bones, and the cranial bones are 8 in number. The classification of the skull. The skull has 22 bones in total. And then it can be classified into two parts, the cranial bones and the facial bone. On top are the cranial bones. On top are the what? Cranial bones. Then this white part is the facial bone. The cranial bone, one of the functions of the cranium or the cranial bone, we can call it cranium or the cranial bone, is that it protects the brain. This one now on top is the cranial bone. Why this one that is colorless is the facial bone. It forms the the shape of the face, and it houses some organs like the eyes and others. So, but I want you to learn very well in this academy. I am not here to just teach you for teaching sake, but by God's grace, help you learn. Now, on top of this place are the crania, or called the cranial bone, or called the cranium. Why this white area are the fascia? And like I said, we have what? 8 cranial bones. We have 8 cranial bones and 14 facial bone. The 8 cranial bones, they protect the brain. The 14 facial bone, they form the bulk of the face and house some organs like the eyes and others. Are we together? Please notify me. Can you hear me? Notify me. Can you hear me? Notify me. Can you hear me? All right, let's continue. I'm impressed. So, 8 cranial bones. Number one, we have what are the 8 cranial bones? Number one, the frontal bone. Number two, the parietal bones. We have the temporal bones. We have the occipital bones. We have the sphenoid bones. And we have the what? The ethmoid bone. The temporal, the parietal, the sphenoid, the ethmoid. These are the cranial bones. Then the facial bones, which are 14, we have the maxillaries, we have the zygomatic bones, that's the cheekbone, we have the nasal bones, we have the lacrimal bones, we have the palatine bones, we have the inferior nasal concave, and we have the vomer and the and the what? Mandible. Now, follow me before I simplify it for you. Then we have the lobes of the brain. The lobes of the brain is totally different from the skull, but it is these cranial bones that protect the lobes of the brain. Follow me, I will still explain. So now in the lobes of the brain, we have the frontal lobe, we have the parietal lobe. Make sure you're writing the lobes of the brain. We have the frontal lobe, we have the parietal lobe, we have the temporal lobe, and the occipital lobe. All right? Don't be confused. Then these are the lobes of the brain. Look at the frontal lobe. These are the parietal lobe. We have the occipital lobe, and we have the temporal lobe. This is the brain. We will soon enter the nervous system, but you need to understand this basis. So, what is the definition of the lobes? The lobes are just division, because like in your different nursing schools, we have year 1, we have year 2, we have year 3. So in the brain also, we have lobes, that they are collection of nerve fibers that does a specific kind of work. For the frontal lobe, they do a lot of thinking. For the parietal lobe, they do a lot of what? Sensation, like pain. Temporal lobe, they do a lot of function like hearing. Then the occipital lobe, they are involved in what? Vision. These are the lobes of the brain. Follow me before I simplify. So finally, we have sutures. Suture is an immovable fibrous joint between the skull bones. Sutures are immovable fibrous joints between the skull bones. So that is why when a baby is coming out in the womb or from the birth canal, the head becomes shapeless. It is as a result of these sutures, and the fontanelles. They are not fully formed. So they help the baby what? Bypass the birth canal. But they get stronger when the child grows to an adult. Now, these are the sutures. These are the sutures. These are the sutures. They are joints that connect these bones. They are joints that connect these bones. Now, examples of the sutures, we have the coronal sutures, we have the sagittal sutures, we have the lomboid suture, and we have the squamous suture. Coronal suture, sagittal suture, lomboid suture, and squamous suture. Now, for this suture, the parietal, I will still explain all these things. The parietals are always present. Are we together? The parietal are always present. Looking at this now, the parietal plus the frontal gives us what is held by the coronal suture. Parietal plus the parietal is held by the sagittal suture. Parietal plus the occipital is held by lomboid suture. Parietal plus the temporal is held by what? Squamous suture. Before I simplify this, give me a notification if you can hear me in the comment section. Notify me. Can you hear me? Can you hear me? I want to see your comments so that I will know that you are following. Can you all hear me? All right. Now, looking at this, we have the frontal bone. The frontal bone. On top of everyone's head, we have what? The parietal on top. I want you to place your hand on top. On top of the head, we have two parietals. Two parietals. Then below the parietal, we have the temporal bone. On top, we have the parietal. Below the parietal, we have temporal bone. Then at the back of your head, we have the what? The occipital bone. And hidden, we have the ethmoid bone, and this is the sphenoid bone. Now, let us simplify. When you are being given this bone in the exam hall, you enter the hall and you are being given the skull bone for your Viva in your exam. The first thing you're going to do, you greet your examiner. Good morning, sir. Good morning, ma'am. My name is Nurse Brainy. My exam number is this. I am giving this bone to identify for my Viva exam. Now, you are going to use what I call the BLS formula. BLS, Nurse Brainy shortcut, BLS formula, which is what? Identifying the bones. B stands for what? Bones. L stands for what? The lobes. And S stands for what? The sutures. Write it down. Whenever you are given the bones of the skull, you are going to use Nurse Brainy shortcut, which is what? The BLS formula. This BLS formula will help you have a lot of things to say. Will help you gain a lot of mark. Will help you, give you precision. It will help you it will give you direction. And what is our formula for using Nurse Brainy shortcut? BLS formula. B standing for what? The bone. L standing for what? The lobes. S standing for what? The suture. Now, under the B, let us explain the B. We have the bones of the cranium. Remember, we have 22 bones. 8 for the cranium, this colored part, and 14 for the fascia. Now we advise you in your exam. I will still give a detailed class on the 14 fascia. But if that will confuse you, I will advise you to go with the identification of the cranium. That's the cranial bones, which are what? Number 1, sphenoid. Number 2, frontal bone. Number 3, parietal. Number 4, temporal. Number 5, occipital. Now, we have 2 parietal, one on the right, one on the left. There are 2 parietal, and we have 2 temporal. These are the 2 bones that are 2 in number. The parietal, the one on top, I call it nose-brainy shortcut, the parents giving birth to two children, the tempora. So on top we have the parietals, the parents, two parents, and below we have two children, the tempora. The parietal on top, two, tempora, two. So we have the ethmoid, we have the sphenoid, we have the frontal, we have two parietal, we have two tempora, and one occipita, giving us what? 8 cranial bones. That is for our B. Remember our shortcut BLS. Then immediately you are done explaining this bone, you go to your L. You will say, Ma, sir, there are lobes of the brain. And the lobes of the brain are the what? The sphenoid, the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. So why am I using the BLS formula? The only difference between the bones, the bones of the skull and the lobe of the skull are two brothers, which are what? Sphenoid and ethmoid. So for being in this class this night, I don't want you to ever forget the cranial bones, which are 8 in number. And the difference between the cranial bone and the lobes of the brain is only two brothers, ethmoid and sphenoid. So everything that you write in the bones of the skull, you will write it in the lobes of the brain. The only difference is the sphenoid and the ethmoid. They are not located in the lobes. Please, I don't know if you are following me. I am here to make you internalize this. Whenever you are sleeping and they wake you up, what are the cranial bones? You are going to list them. They are 8 in number. Why the lobes are 6 in number? Because of what? We remove two brothers, which are ethmoid and sphenoid, in the lobes. But in the bones of the skull, we have frontal, we have two parietal, we have tempora, we have occipita, we have sphenoid, we have ethmoid. In the bones, we have these two brothers, sphenoid and ethmoid. But for the lobes, we don't have sphenoid and ethmoid, but we have frontal lobe, we have parietal lobe, we have temporal lobe, we have occipital lobe. But for the bones, we have frontal bone, we have parietal bone, we have temporal bone, we have occipital bone, and two extra brothers, which are what? Sphenoid and ethmoid. Please, are we together? Now, to know if you're following me, what is our shortcut when you enter the hall? What is the first shortcut, nose-brainy shortcut that should come to your mind? Which formula should come to your mind that will give you direction? I'm impressed. The BLS formula. B standing for what? The bones. And you will list the bones, the 8 cranial bones, frontal, sphenoid, parietal, temporal. I'm impressed. Perpetual, I'm impressed. Favor, I'm impressed. I'm impressed. All right? So, now, I want you to internalize this. I don't want you to cram it again. Remember, some of you, when you are in the exam hall and you are thinking, you enter the hall and you are thinking and you forgot what to write, you will notice you'll be hitting your pen on your forehead. You are doing this because you are trying to rack your brain, because the front is the place for thinking. The frontal lobe is the part of the brain for thinking. Now, if someone hits you at the occipita, at the back, it is the part of the brain lobe that is responsible for what? For vision. Then, when you put your hands in a hot flame, that you are able to feel that pain is as a result of the parents, the parietals. Please, I want you to know these things. That is why I made a live class. I want you to know it. Let it become part of you. Then, as I am teaching now, your ability to write, I'm seeing all of you writing the BLS. I'm impressed. I'm seeing all of you writing the BLS. I'm impressed. Your ability to learn this is as a result of your temporal lobe. The temporal lobe helps in memory, language understanding, and hearing. So in your exam, you've greeted your examiner, you remember the BLS formula. I will advise you to leave the facial bone. We have the mandible, we have the maxilla, we have the vomer, we have the lacrima, I will still explain those in another class. But for your safety, I will advise you, go with the BLS formula. Before that, your time will be up and you will gain your marks. Good morning, sir. Good morning, ma. My name is so, and so. I want to identify the bones of the skull. You are not going to mention the BLS. It will be in your mind already. So you mentioned we have, and that is our B. The bones, we have there are 22 bones, 8 cranial and 14 facial, making it 22 total bones of the skull. Now, the bones of the cranium are the frontal. We start from the front, always start from front. If you start from front, you go to the back. From the frontal to the occipital, then on top to the parietals, 2 parietals, then the 2 children, the temporal, and the 2 extra brothers that is not in the L, in the lobes, sphenoid and ethmoid. Then after that, you say, man, there are lobes of the brain, and it is these cranial bones that protect the lobes of the brain. And we have the frontal lobe, which helps in what? Thinking. We have the occipital lobe, which helps in what? Vision. We have the parietal lobe, which helps in sensation. And we have the temporal lobe, which helps in what? Hearing and memory. Ma or sir, it is these cranial bones, the frontal bone protect the frontal lobe, the parietal bone protect the parietal lobe, the temporal bone protect the temporal bone protect the temporal lobe, the occipital lobe bone protect the occipital lobe. It is these cranial bones that protect the parts of the brain. Having said this, you're already impressing your examiner. Then you quickly go into what? The S, which is what? The sutures. We go into the what? The S, which is the what? The sutures. So, like I said, the sutures are immovable joints. That is why when you see a baby coming out from the womb through the birth canal, the head becomes shapeless. It's as a result of this what? Immature sutures. That is why it's not good to hit a child on the head, because you can affect the brain. These sutures help to what? Keep the brain intact and against pressure, and they join these bones. So these are the 2 parieta. Like I gave you Brainy shortcut, we have 2 parieta, and Brainy shortcut for it is the parents' bone. You see, it is very big. The parents' bone, 2 parents, a man and a woman giving birth to 2 children, which are the temporals, closer to the ear. So there are 2 parietal bone and 2 temporal bone. Now, for the sutures, like I said, the parietals are always present in the suture. The parietals went round the brain. The parietals, they went round the brain. So these sutures are like bridges, and the parietal went round the brain, the skull. Now, parietal plus parietal, this is the suture there. This straight line is the suture. Parietal plus parietal will give you, the suture there is what? The suture that join the parietal bone plus the parietal bone is what? Sagittal suture. The parietal plus the occipital bone, that's the occiput, is the what? What suture is between them? The lambdoid suture. The parietal plus the temporal, the suture there is the what? The squamous suture. The parietal plus the frontal, the suture there is the what? Frontal suture or the coronal suture. Please, are you learning something in this class? That the parietal moves around. This is the way I'm simplifying this by God's grace. The parietal moves around. So parietal plus parietal, the suture there is sagittal suture. So if you understand your BLS formula, you understand the bones, you have understand that the bones are protecting the L, which is the lobe, then you now quickly go to your suture. What joins these bones together? So if you can identify your parietal bones, parietal plus parietal, the suture that holds the parietal bone plus the parietal bone is the word sagittal suture. Look at it in the middle, sagittal suture. The parietal plus the occipital bone, the suture that holds join it is the lomboid suture. The parietal plus the children of the parents, the tempora, the suture that joins it is the what? Squamous suture. Then the parietal plus the frontal bone, the suture that joins it is the frontal suture, or called the coronal suture. Please, are we together? Are we together? So parietal plus frontal, coronal suture. Parietal plus parietal, the suture that joins it is sagittal suture. Parietal plus occipital, the suture that joins it is what? Lomboid suture. I know this suture of a place will be difficult for you people, so I will explain it again. Now, we have what we call the BLS formula. Now, looking at this picture, I will use this image to explain it. Looking at this image, you will see lines. These are sutures. It's just like sewing something. So God created it in that way that the bones will be held together while still in the womb. They are not firmly held together, because if they're firmly held together, they cannot come out from the birth canal during delivery. So God made it in a way that they will be flexible. They are not meshed. They are not connected yet while still in the womb. Though they are connected, but they are not firm yet. That is why when they give birth to a baby, you will notice that the head is shapeless for some time till it comes back to shape, because these sutures are flexible. These sutures are what? Flexible. But when the child is being delivered, these sutures start getting firmer and stronger up until adulthood. So these sutures, just think of these sutures as the sewing two clothes. So the needle and thread that sews the frontal bone plus the parietal is called the sutures. Look at the sutures there, joining these bones together. Now, what are the bones of this skull? What are the cranial bones? We have the what? Frontal bone, 2 parietal, 2 tempora, 1 occipital, 1 sphenoid, and 1 ethmoid. Now, this frontal is joined together with this parietal. Look at the yellow and the blue. This frontal is joined together with the parietal by a suture, by a needle and a thread called the what? Frontal suture or the coronal suture. This parietal is joined with the squamous. Look at the squamous, the temporal bone, by a suture called the squamous suture. This parietal is joined with the occipital by a suture called the what? Lomboidal suture. There is 2 parietals, so the parietal on the left is joined to the parietal on the right by a suture in the middle called the what? Sagittal suture. So when you enter the exam hall, all you are going to do, you have already noted this down, the BLS formula. Though I made a video on this that I will be showing you, a physical video in my lab, in the nursing procedure room. So I'll be showing you so that I will identify it, you'll be seeing it clearly. But I want you, why I'm making this class, so that I will explain it. And if you have questions, you ask your question during the live interactive class. Are we together? So we have the BLS formula. Good morning, sir. Good morning, ma'am. My name is Nurse Brainy. My exam number, not your reg number again. Your exam number is this, this, and this. I am here to identify the Viva, the bones of the skull. Now, the bones, the skull is the bony framework that protects the brain. It is classified into 2. Number 1, the cranial bones, and the what? The facial bone. Both of them summing up to what? 22 bones. we have 8 cranial bones and 14 facial bones. Examples of the facial bone, we have the mandible, we have the maxilla, we have the vomer, we have inferior nasal concave. Now, I will advise you, though I will make a class on this, but I will advise you to use the BLS formula. You go in straight. We have the cranial bones, and there are 8 in number. Number 1 of the cranial bones is the frontal bone. This yellow part now, frontal bone. Number 2, 2 parietal bones. The next one, the temporal bones. This one located next to the ear. The next one, the occipital bone, the sphenoid and the ethmoid. I come again, the frontal, the parietal, the temporal, the occipital, the sphenoid, and the ethmoid. Once you are done with this, you say, there are lobes in the brain. And these lobes in the brain are protected by these bones. Examples of the lobes in the brain, that is our BLS formula. Examples of the lobes in the brain are the frontal lobe, which helps in thinking. The parietal lobe, you see, we are calling the same names we called in the bones. We are calling that same name we called in the bones. The only difference between the bones and the lobe is that the lobes does not have these two brothers, sphenoid and ethmoid. So let me call the bones again. That is why we are making this class live, so that you understand it, so that it will be internalized. Because the video I made, I did not use this formula for you. So I want, after this class, if you are sleeping and they wake you up, for being in Brainy Academy, an academy that by God's grace helps you to internalize and learn using Brainy shortcut. For being in this academy, I want you to be perfect. Once you are called on, what are the cranial bones? The cranial bones are also called the cranium. We have number 1, the frontal, the frontal, the parietal bones, the temporal, the occipital, and these two brothers, the sphenoid and the ethmoid. What are the lobes of the brain? The frontal lobe, the parietal lobe, the temporal lobe, and the occipital. The lobes does not have these two brothers, the sphenoid and the ethmoid. Please, are we together now? Notify me in the comment section. Are we together? If we are together, notify me. All right, I'm impressed. Then the sutures are I'm impressed. God's favor, I'm impressed. Favor, I'm impressed. Mesom, I'm impressed. So the sutures are just the thread, the needle and the thread that connect these bones together. That is the sutures. From the word suture, they are immovable joints, cannot be moved. The parietal bone is protecting the parietal lobe. The temporal bone is protecting the temporal lobe. The occipital bone is protecting the occipital lobe, where we have the cerebellum. I will still explain that. The frontal lobe in next class, the nervous system. The frontal lobe is protecting the frontal lobe. That is why some of you, when you are thinking in the exam hall, you'll be hitting the front of your head or you'll be touching it. You are trying to think. You are trying to think. Are we together? The frontal lobe, that is the lobe for thinking. The parietals, Brainy shortcut for the parietals, they are the ones that are 2 in number. Parieta, a man and a woman. Parieta by the left, parieta by the right. A man and a woman giving birth to 2 children, which are the temporal by the left, temporal by the right. So in the exam, for your exam station, you are thinking which one is 2 in number. You should know that is the what? The parieta, the man and the woman, or the parents, then the children, the temporal. They are the only bones that are 2 in number in the cranium. The 2 parietal and 2 temporal. The occipital is 1, the frontal is 1, the sphenoid is 1, the ethmoid is 1. Then for the lobe, in the lobe, there is no sphenoid and there is no ethmoid. But there is frontal lobe, there is parietal lobe, there is temporal lobe, there is occipital lobe. It is in this temporal lobe that we have the ear. The ear is located, which helps in hearing and memory and language understanding. This parietal, that you're able to feel pain or some certain sensation, is as a result of these parents, the parietal lobes, which are 2 in number. For you to think, we use the frontal lobe, protected by the frontal bone. For vision, we use the word occipital lobe, protected by the occipital bone. Then this white area is the what? The facial bones. We have the movable joint, the only movable facial joint, which is the what? Is it the maxilla or the mandible? Let me know if you are following. I never mentioned it, but the movable joint, is it the maxilla or the mandible? Send it to me on WhatsApp. So we have 8 cranial and what? 14 facial. Now, question. I'm impressed. Antenna from ENU, I'm impressed. Mesoma, I'm impressed. Mandible, you are correct. Mandible. So in exam, for you not to stress yourself or strain yourself, because Viva comes with what? Tension. I will make a class on how to write projects also. We'll have a class on how to write projects so that you won't be rewriting and repeating. So and we'll have a class on nervous system and urinary system and respiratory system. Please, I would have loved if people will notify me. I have so much passion for the May candidate. So I feel like, because there are places I work, some are on hold. So I am a bit timed. I have a lot of time this month, more than I will have next month, because I will get very busy next month. So the May candidate, if there are times during the day we can have classes, I want to ensure that you pass. Many students chatted me for March March candidate. They notified me that they passed. They sent me their reviews because we had a lot of class, and I'm happy about that. My greatest desire is to see that all of you pass. So quickly, now another thing for the fetal circulation, the class we had on fetal circulation, there is something I'll tell you in our WhatsApp group. There's what we call the ligamentum teres, which I will explain in the WhatsApp group. Now, question. Number 1 question. The parietal bones merges with the frontal bone by what suture? A. Lambdoid suture. B. Coronal suture. C. Sagittal suture. D. Squamous suture. The parietal bones joins with the frontal bone and they are connected by what suture? A. The lambdoid suture. B. The coronal suture. C. The sagittal suture. D. The squamous suture. What is the correct answer? Yes, I'm impressed. These students, you are wonderful. I'm impressed. B is the correct answer, the coronal suture. Another name for the coronal suture is the what? The frontal suture. Now, for being in this academy, you have noticed that parietas merges with all. That is why I call it Nosbrain shortcut the parent's bone. And there are 2 in number. Giving birth to 2 children, the 2 tempora. I'm using all these children, 2, so that you know they are the only ones that are the cranium bone that are 2 in number. Others are 1. So number 2 question, the parietal bones merges with the parietal bones by what suture? A. Coronal suture. B. Lambdoid suture. C. Sagittal suture. And D. None of the above. Yes. Those writing B, hope is not number 2. You are answering B. I'm impressed. Those that picked C, very correct. The sagittal suture. Okay, those writing B, they are way behind. They're not following. Okay, they didn't join on time. All right, they're answering the B for number 1. So you are correct. The sagittal suture. Whenever you hear the word sagittal, it divides the plane into 2. Now, number 3, the parietal bones joins with the temporal bone by what suture? A. The coronal suture. B. The squamous suture. C. The sagittal suture. D. The lambdoid suture. The parietal bones joins with the temporal bones by what suture? A. The coronal suture. Those answering D. You're not correct. You're not correct. So I will go back. Very correct. Antenna, you're correct. Now I will go back because I want you to learn. We are almost done. This is the temporal bone. I want now send me your notes, send me your drawings. This is the temporal bone. Look at the temporal bone. This is the temporal bone. This is the frontal, the yellow part. This orange part is the temporal, the one close to your ear. Now, another shortcut for you never to forget it. She has a temporal ear. So they write it down. She has a temporal ear. So the bone close to the ear is the temporal bone. The one at the back of your head is the occipiter. The one on top that covers the cerebrum very well is the parietal. That's why I call it the parent's bone is on top. And there are two parietal. And two parents give birth to two children, two temporal. So the connection between the parietal. Now, this is another shortcut, was very shortcut. The connection between you and your parents is squamous. The connection between you and your parents is what? Squamous. It is plain. So the connection between the suture between parietal bone and the temporal bone is squamous. Write it down. The connection between you and your parents is squamous. The parent's bone with the temporal bone is what? Squamous. Lambdoid is at the back, the occipital bone. The parents plus the occipital is the lambdoid suture. Parents plus the frontal, parietal plus the frontal is what? Coronal suture. The suture between the temporal and the parietal, the parents and the children, is squamous. Parents and children, squamous. Don't forget it again. Now, we'll be ending the class very soon. Now, I want you all to give me a Viva, like after the fetal circulation in the Telegram group. Now, we'll be doing Viva in this live, but main class, some certain classes will be done in Telegram because it is locked. Now, I want you to give me a Viva talk. You are going to, because the last class, a student sent me a description of fetal circulation, how the blood flows. And I love that. I didn't send it to the group. So I want you all to make a Viva discussion. Assume that you're in the exam hall and send it to me. You by greeting, good morning, sir. My name is this, my reg number is this. I am here to carry out a Viva on this. And within your mind, you have placed the first thing on your brain, BLS, describing the bones. And there are two description of the bones, classification. Number one, the cranial and the word fascia, making a total of what, 22 bones. The cranial or the cranial bones are 8 in number, or the cranium, then the fascia are 14 in number. Then I will advise you can list the fascia. We have the mandible, we have the maxilla, we have the palatine bones, we have the vomer, we have the inferior nasal concave, we have the lacrimal bones. These are the facial bones. I will make a detailed class on that. But in the exam hall, if you are tensed, I will advise you go with the BLS formula, describing the cranial bones, which are what? The frontal, the two parietal, the two temporal, the occipital, the two extra brothers that are not in the L. That is why I gave that formula, BLS. The two extra brothers, which is the sphenoid and the ethmoid. Then you tell your examiner, my examiner, there are lobes in the brain. We have the frontal lobe for thinking. We have the parietal lobe that feels sensation. We have the temporal lobe for hearing, and we have the occipital lobe for vision. They are all covered and protected by the bones, by the frontal bone, the parietal bone, the temporal bone, the occipital bone, and this. Then you can call the two brothers, sphenoid and ethmoid. Then quickly you go into sutures. The sutures, which are the immovable joints in the brain, in the skull bone. The suture between the frontal bone that joins the frontal bones and the parietal is what? The what? Coronal suture. The suture that joins the parietal and the temporal is the what? Squamous. The suture that joins the parietal and the occipital is the lambdoid, and the suture that joins the parietal bone is the sagittal. Please, we will end the class here. Notify me, how was the class? Did you learn something? This class is not just, I don't want to make it short. I want to make it detailed so that it will sink inside your brain. When others are fidgeting, you are in Brainy Academy, you should not fidget for Viva. You should go in with Viva. You should go in with alacrity. I will still make a shortcut on how to do bed making. Bed making is very simple. I will make a detailed shortcut on that. So notify me, how was the class? How was the class? Hope you learned something in the class. I will still send a video across, the video I made for you all in the demonstration room. So how was the class? Hope you learned something. Can you hear me? How was the class? Hope you learned something. The sutures are immovable fibrous joints between the skull bones. The sutures are immovable fibrous joints between the skull bones. They protect, look at them, they join the bones. This is the parietal bones. This is the suture that joins it, just as a needle and a thread joins two fabrics that are torn apart. The sutures are joints. They join these bones together. This is one parieta, this is another parieta. The suture that joins it is the sagittal suture. Someone said I should explain these sutures again. The suture that joins them is the what? The sagittal suture. The sutures, this V-shaped suture that joins the occipital bone and the parieta is what? Lambdoid suture. The suture that joins the parieta and the one in the ear, which is the tempora, is the word squamous suture. The suture that joins the frontal bone, the bone in the front, and this parieta is the word coronal suture. Well simplified. Cynthia, I'm impressed. I'm impressed. I'm impressed. So if you are not, if I have not approved you in the, yes, I learned a lot and I pray to remember all. You will remember everything. Just write it down in your book. BLS formula. I want to see your comments. If you're not in the WhatsApp group, I want to see your comments so that I will add you to the private WhatsApp class. I really learned something this night. I'm impressed. I'm impressed. Now, please send me your reviews on WhatsApp. 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 I believe there is no questions again. So this the bones houses it. So there are only two brothers that are not in the lobe, the sphenoid and the ethmoid. Other bones, other names are in the lobe. The same names in the. Okay, you are not in the WhatsApp group. Okay, when I end this, you send me a WhatsApp, send me a message on WhatsApp. Send me a message on WhatsApp. Now, for the fetal circulation, the ductus venosus becomes, okay, I will explain it in the WhatsApp group. But please notify me, remind me to explain all this. Remind me. When the ductus arteriosus does not close, when a baby is born, and that is from our last class, when a baby is born and the ductus arteriosus does not close, it becomes what? It becomes what? Patent ductus arteriosus, PDA, for your exam. When a baby is born and the ductus arteriosus does not close, the baby might not cry because the ductus arteriosus needs to close so that the pulmonary resistance will will increase so that the air will rush into the lungs. So in a situation where the ductus arteriosus does not close, it becomes what we call PDA, patent ductus arteriosus. Patent ductus arteriosus. That is what I want to chip in. So we have the BLS formula. Please don't forget it again. So God bless you. God bless you. God bless you. Have a wonderful good night rest. So send me your reviews on WhatsApp. I will leave the notes into the next 9 minutes so that you can copy. Thank you too. Thank you. God bless you. Mesoma, once I end this live lecture now, you comment on this so that if you don't have my number, so that I will add you to the WhatsApp group. Please send me your reviews on WhatsApp. Send me your reviews on WhatsApp. Send me your reviews on WhatsApp. I want to see them. God bless you. Good night.